The discovery of age-related macular degeneration is a disheartening diagnosis. Typically, by the time a person notices a loss of vision, they have already suffered significant degeneration of the macula. That's why there is considerable excitement around omega-3 and its potential benefits when added to the already proven AREDS formulation. In this presentation, we will explore the science behind AMD and the expanding role that ocular vitamin supplements play in slowing its progression. As the name implies, age-related macular degeneration happens over time and involves the slow breakdown of the components of the macula. This breakdown happens because of oxidative stress. Oxidative stress is an imbalance between the healthy function of cells and the damaging effects of oxidative agents such as free radicals. As people age, free radicals increase in number and initiate a cycle of destruction. This is evidenced by inflammation in the photoreceptors and other cells in the eye, and later in the death of the cells themselves. As these cells disintegrate, discarded cellular material builds up at the back of the retina and forms drusen, the hallmark of AMD. When occurring over decades, the breakdown of photoreceptors and formation of drusen leads to a loss of central vision. The introduction of the AREDS formulation first provided us with a way to combat this destructive cycle. By increasing the quantities of specific antioxidants, including beta-carotene, vitamin C and E, as well as zinc and copper, we are able to counterbalance the large number of free radicals in the retina and, in turn, slow the destructive cycle generated by damaging oxidative agents. The age-related eye disease study showed this clinically across a large population. Beyond the AREDS nutrients, scientific evidence also supports the use of lutein and zeaxanthin to help shield the retina from blue and ultraviolet light. This is important because when light is able to penetrate the retina, it increases the production of free radicals, which can increase the risk of AMD. In fact, one study found that eyes with AMD have 32% less lutein and zeaxanthin than eyes without AMD. It is important to supply lutein and zeaxanthin through the diet or supplementation in order to repair and restore the protective pigment layer, since the body cannot synthesize these nutrients. Once it regains its thickness, as measured by macular pigment optical density, this layer can block the penetration of blue and ultraviolet light to help protect against AMD. This was demonstrated by the Veterans Last study, which showed that an increased intake of lutein and antioxidants may lead to a significant increase in macular pigment optical density. Researchers have discovered a relationship between the increased intake of omega-3 and a reduced risk of disease progression. The two omega-3 fatty acids that are most relevant to ocular health are DHA and EPA. DHA and EPA are long-chain fatty acids found in the membranes of most cells. In the eye, they are believed to help fight degeneration in a number of ways. First, both DHA and EPA inhibit the production of prostaglandins, which are pro-inflammatory molecules. By doing so, they work together to directly reduce the inflammation caused by oxidative stress. DHA is also a major component of the membrane of photoreceptor discs. If supplemented in the diet, this lipid is able to transfer directly into these cells to help maintain their normal functioning. If enough is supplied over time, DHA can actually regenerate rhodopsin, which is key to initiate visual sensation in the photoreceptors. Finally, EPA is also believed to reduce angiogenesis, which is the development of neovascular blood vessels that leads to wet AMD. The clinical potential of omega-3 was revealed in the AREDS 20 report, which found that increased omega-3 intake resulted in a 39% reduction of risk of progression to wet AMD. Based on the findings from the AREDS 20 report, Ingesting greater than 2 servings of fish per week, or 230 grams of fish, is what gave patients such significant results. This is equivalent to 500 milligrams of DHA and EPA per day. A recent study also revealed that fish oil is the ideal source of DHA and EPA. These long-chain fatty acids found in fish are more readily beneficial to the eyes than the short-chain omega-3s derived from plants, such as flaxseed or nuts. Typically, omega-3 fish oil is available commercially in 2 different forms. The more natural triglyceride form is more easily absorbed than synthetic varieties. Finally, omega-3 supplements from fish oil are believed to be safer when derived from small oily fish such as sardines and mackerel. These fish are exposed to fewer pollutants than larger fish, which are higher on the food chain. As we've seen, clinical science continues to refine our understanding of the role of ocular vitamins in slowing the progression of AMD. Talk to your eye care professional about how the use of an ocular vitamin supplement that combines the original AREDS formula with lutein, as well as a high-quality omega-3, can help protect your vision.